Yes, so good afternoon and good morning, everyone, depending on your time schedule. A very warm welcome to the second webinar in our new webinar series, and this one is the fifth one in a series of webinars on the impact of COVID-19 on food systems in Africa. So before we move on, allow me to introduce myself as I'll be chairing this session today. My names are Edith Lukanga. I'm the co-founder and executive director of Environmental Management and Economic Development Organization, shortly called EMEDO, a non-profit organization working in the socio-economic development and environment in Tanzania. We are working towards addressing challenges such as gender equity, food security, and poverty alleviation. So this webinar series is hosted by the Institute for Poverty, Land, and Agrarian Studies, the PLAS, at the University of the Western Cape. Today's webinar is co-hosted with the University of Ghana, Agri University, and Environmental Management and Economic Development Organization, EMEDO. The context for today's webinar is a research project underway entitled The Impact of COVID-19 Responses on the Political Economy of African Food Systems. We started this in October last year, and we have been implementing it through a collaborative partnership of university researchers and civil society organizations in Ghana, Tanzania, and South Africa. This event reports on preliminary insights from the field research. As we start, I encourage you all, our viewers, to introduce yourselves in the comment section. Please tell us who you are, where you are from, and even your institution or organization. And maybe some of you will be asking, why Ghana, why Tanzania and South Africa? There are contrasts between our three countries involved in this project. Tanzania has largely smallholder-based farming and fishing sectors and many small enterprises in the food retail. South Africa's food system is dominated by a large farm sector and a few big supermarkets, while Ghana is somewhere in between, more similar to Tanzania, but with bigger farms and more centralized value chains emerging. And in terms of the government's responses to COVID-19 too, we are seeing a sharp contrast between and among these countries. South Africa imposed a hard and long lockdown, whereas Tanzania has had no state-imposed lockdown, and Ghana had a short lockdown and limited ongoing restrictions by the state. We would like to recognize the support of the International Development Research Center in supporting this research. And before we start, let's clarify what we mean by social reproduction. By agreement, I will briefly sketch this out before we turn to our speakers for today. By social reproduction, we mean the full range of activities and hard work that are essential to the functioning of our societies and economies. This requires us to think beyond the realm of production, trade, employment, and draw attention to all the time, efforts, and labor involved in keeping people alive and well enough to keep going, including producing the next generation. This is overwhelmingly work undertaken by women, though not exclusively, but also differs across contexts and can and does get challenged and changed. Both mainstream and conventional Marxist economists has largely ignored this realm of social reproduction, focusing instead on production and relegating the reproduction of society and the reproduction of workers to being within the domestic sphere. As the social reproduction theorist Titi Bhattacharya has asked, what did Marx have to say about cooking dinner? Not a lot. Feminist critics have argued that we should not see these spheres of production and reproduction as separate. Looking after children and the elderly, cooking, cleaning, fetching water, education, and health are integral to people's ability to be in the economy, to farm, to fish, and to travel and to trade. Bringing these realities out of the private sphere helps us to understand the important role the private sphere plays in making the activities we undertake in the public sphere possible. What happens after the workday ends is an important for what happens during the workday as vice versa. Although social reproduction is integral to our economies, it is largely unpaid and little attention is paid to what makes it possible for social reproduction to take place. Feminist critics emphasize the importance of recognizing and adequately compensating actors engaged in social reproduction. Our project investigates how responses to COVID have affected power dynamics, benefits, and costs among actors in the food system. Our interest here is in both how these COVID regulations and mitigation measures have impacted on the social reproduction of food system actors, as well as that of their families and communities, and how this in turn shapes power and accumulation in the food system. So we are looking at the impacts of COVID regulations and mitigation measures on the social reproduction of the people who produce and trade our food, and in turn, how these changed circumstances limit their power and involvement in the food system. So finally, if you're on Twitter or other social media, we are using hashtags that I would like to mention. Please take a note of them. The first one is African food systems, and the other hashtag is social reproduction. I will repeat, African food systems and social reproduction. So feel free to share your thoughts and reflections with us, in using those hashtags as well. So with all that said, I will now hand the floor over to the people you came to listen to. And our first speaker for today is from Ghana, named Akosua Dakwa. Akosua Dakwa is an associate professor of sociology at the University of Ghana. Her research focuses primarily on exploring the ways in which global economic policies and practices reconfigure Ghanaian women's work. Over the last 2 decades, she has studied market traders, domestic workers, factory workers, farmers, and for this project, food system actors. Akosua, please, the floor is yours. Go ahead, please. You have about 5 to 10 minutes for your intervention.
Good afternoon, wherever you may be. So I present the findings from Ghana. These are preliminary findings. The work is in progress, but we have some interesting findings we want to share and discuss with colleagues around the continent and the world. So first, in thinking about household reproduction, feminist economists and feminist social scientists argue that it's not primarily or only the responsibility of those within the household. Those outside a household should be as equally concerned about supporting and making it possible. So states, corporations, and so on and so forth. So in our Ghanaian case, we looked at over the last year with COVID, what other kinds of support people had within their households to enable social reproduction. So this came from 3 places. First was the non-state. And in Ghana, we had a COVID-19 private sector fund. And during the lockdown, which was for 3 weeks, they provided food for those in the lockdown regions who needed the food. So that came through quite well. A second was the state, which in many places would be the primary source of support beyond the household for what happens with social reproduction. In the Ghanaian case, during the lockdown as well, the state provided food for families that needed it. The state also tried to provide essential services, water and electricity, and it offered it for free for 6 months for electricity and 9 months for water. The problem, though, was that our existing infrastructure is not so great. So people don't have access points within their households, or they don't have meters assigned to their homes. And therefore, they were being billed for it because the private owners of the homes would say, well, I'm not letting you enjoy that benefit. Or in the case of water, it might be free, but the tanker that brings it to your house is going to charge you for the transportation. So the statistics show that only about 22% of the population actually enjoy the benefits of free water. And we all know that water is essential to social reproduction. You need it to clean, you need it to cook, and so on. So during the COVID period, in spite of the good efforts of the state, they couldn't provide us with water as much as they would have liked. A third source of support came from the community. So community members were offering support with childcare. Your neighbor would offer to watch your child while you went off to work. And also in terms of giving you access to food. So for the market traders especially, they would barter food. If I sold tomatoes and somebody else sold fish, I would give her tomatoes and get some fish so I could go home and make a meal. Now, given that, it therefore meant that the primary responsibility for social reproduction during COVID was households. And they had to figure out a way to make it happen, regardless of whatever kinds of support they were receiving from outside the household. So now, in the case of Ghana, what happened? In terms of food preparation, it is, as it is in many parts of the world, primarily a woman's responsibility. We found that if mothers weren't shouldering that burden, it was their daughters who were shouldering that burden. Because of the school closures, which was for 10 months in Ghana, it meant daughters were at home. And the daughters then were being required to provide the food for the family. So they were saddled with the responsibility of cooking and getting the food available for others to eat. Then the other thing was the food itself and whether we would have it available to cook. And we find that in some cases, nothing changed in terms of food. And we have statistics that puts that at about 50% of the population. They were able to eat as much as they did before COVID, but it required certain things. So in some cases, we find that either traders or farmers have a second source of income still linked to the farming food system. So you would be selling onions, but you actually have a cocoa farm. So you have a cash farm that provides income during the period of difficulty. So they relied on that. Others, in terms of the men, would continue to provide the same amount of money for housekeeping. And in Ghana, we call that chop money, and it's seen as a requirement of men to provide it for a household. So the men would provide the chop money, the same amount, regardless of the fact that prices were going up. And it therefore behooved on the mothers in the household to figure out how to stretch the money to make it possible to maintain 3 meals a day. And what the mothers then were doing were two things. One, they would eat into their capital that they used to run their businesses in the markets, or they would go for a loan from the rotating credit system. So we have these, what we call esusu, and they would go for loans to make that possible. This has implications for what will happen with their productive work because it means their capital to run those businesses is dwindling over time. A point that feminist scholars make in saying that these two sectors are connected and we shouldn't think of them as separate spheres. Now, if you couldn't maintain meals as you did in the past, then it meant you decreased the number of times you ate. So we found families who were now eating 2 meals a day instead of 3 because they couldn't afford the 3 meals a day. In addition, you decrease the quality. And the easiest thing that was stripped from the meals was the protein source. Even in a place like Ghana, which has very high small fish consumption, Ghanaians consume on average 25 kilograms of fish a year compared to the average of 20. But even in that circumstance, we find that people are unable to afford the small fish. So they are eating meals without the small fish because they just can't afford it. Now, beyond feeding, social reproduction also includes taking care of children, making sure they are not getting into trouble, they are not getting hurt, making sure that their educational needs are taken care of for the next generation of labor force that we need. And there again, we find interesting dynamics, as in schools were closed, but parents had to find a way. Even though the government was providing an alternative form of schooling, as in TV and radio programs, it required having access to electricity, the television or the radio that you could devote to the child. And in any case, it didn't last all day. So families that could afford it found tuition for their children. If not, then older daughters were again saddled with that responsibility, or you just left them to their own devices. And as one mother said, it was difficult. It was either you work or you take care of your children, and doing both is not easy. Thank you very much.
Thank you so much, Akosha, for such interesting insights. Thanks again. So before we continue, I would just like to remind our audience to please use the comment space to share your own perspectives and comments for other users and other audience members. We also know that there is a lot of knowledge among the attendees, so we very much appreciate hearing your perspectives too. So please do add into the comment space. Now, allow me to welcome our second speaker, Louis-Fred Kisoli from Tanzania. Louis-Fred Kisoli is a development economist, currently working as a lecturer cum researcher at the Department of Economics and Social Studies at Ardhi University in Dar es Salaam, Tanzania. His PhD focused on the integration of smallholder farmers into traditional agricultural value chains and associated food security outcomes. And currently, his research focuses on diverse aspects of development economics with emphasis on food security, agri-food systems, and rural development. Louis-Fred, please go ahead.
And thanks for participating in this webinar. As introduced, I'll be sharing interim findings on the impacts of COVID on African food systems in the context of Tanzania, the focus being on the social reproduction aspects. As already known, Tanzania's response to COVID-19 has been somewhat different compared to most other countries regionally and even globally, as there were no state-imposed lockdowns. However, after the first COVID case on the 16th of March last year, the government did introduce a number of measures, and this included closure of schools and colleges and universities, and some limited restrictions on public gatherings and international travel. These were nonetheless short-lived, and with this context, let's see some of the emerging findings. From our preliminary analysis, there are three key areas of relevance with regards to the implication of COVID on social reproduction of food system actors in Tanzania. The first area is on children, schooling and time. And preliminary insights from our ongoing research shows that the closure of schools, colleges and universities from mid-March to end of May last year sort of adversely affected a section of food system actors. And on childcare, we see that women traders specifically appear to be disproportionately affected as they shoulder the bulk of the responsibility for caring of children. This meant reduced time in productive employment. And an example is one food trader who reported that the fact that the children were at home, she had to prepare a good environment for them and ensure she goes back home early after work to care for them. A section also report that they had to go with their children to the marketplace. And there are a few cases where children had to participate in family income generating activities. Now, on learning, emerging insights point out to challenges in the period following closure of schools. And despite introduction of educative programs in some nationwide TV broadcasters, we pick issues related to access mostly to these educational programs. And this is particularly the case for poor families. Well, other families had to spend more on individual arrangements for children to learn. And emerging from all this is the fact that there is this increased burden, particularly for women, which has adverse implications not only on their livelihood activities, but also on other aspects of family welfare, such as nutrition. Now, the second part is on food procurement, preparation and quality and quantity. The collected data so far shows that food availability at home was affected with those system actors whose businesses were disrupted by COVID being the most impacted. These families indicate that they had to cut food budgets due to increased purchasing power as their businesses were performing poorly. And the brief closure of learning institutions also added a layer of food costs to families. One food trader, for example, who is also a mother of 5, narrated that they had to stretch their budgets because children were now staying home, while as a family, they were not prepared. Now, in addition, and although it may be premature to conclude, our interim findings also show that indicate to a direction that although women are traditionally burdened by the responsibility of food preparation, while we know that men are largely dependent upon for food provisioning, women could have played a considerable role in both food provisioning and preparation. All this now raises critical questions on the quality and quantity of food, and subsequently the implications on food and nutrition security, among others, of these food system actors. Now, the third area and the last one is on community and state support. And here it is important to first point out that the government did not roll out any support scheme or safety net programs to particular groups. And with lack of state support, insights into our preliminary findings show that there was widespread use of social networks, informal credit, and in some cases drawing down on own food businesses as strategies for providing food for families and coping during this COVID period. This is nonetheless applicable to the food system actors who responded to have their businesses or employment adversely affected by COVID disruption. However, we need more data and analysis to be able to continue validating this. Now, the key takeaway is that despite having mild restrictions and no economy-wide lockdowns in Tanzania, the effects of COVID on the food system, particularly its actors, stem primarily from the shrinkage in economic activity owing to the global slowdown, the near collapse of the tourism sector and the hotel sector for that matter, and the diminished private sector employment and to some extent the Tanzania's cross-border trade. And the COVID effects may have disproportionate effects on food system actors at the lower band, and particularly given the lack of state support in terms of welfare schemes or other forms of safety nets. And with that, I think I should thank you, and that's the end of my presentation. Thank you.
Thank you, Louis Fred. Thank you so much for sharing with us these preliminary findings from Tanzania that have brought up very interesting insights. Allow me again to come back to our viewers on YouTube and Facebook, because this session is being live streamed. Please do add your own questions to the comment box if you haven't done that yet. We are particularly keen to hear from people who are involved in the food systems in some way or the other, those who are working with people who are farmers, fishers, traders, and others. So please don't miss this opportunity and share your comments. And now allow me to introduce our third and last speaker for today, Ruth Hall. Ruth is a researcher at PLUS at the University of the Western Cape, where she holds the South African Research Chair in Poverty, Land and Agrarian Studies, and is the primary investigator for this project. She's based in Cape Town. And Ruth, please go ahead.
Thanks, Edith. To start with, perhaps I should clarify that in South Africa, we've actually looked at 3 different case study sites. So our first case study site is with small-scale fishers, fishing communities around the Western Cape and around Cape Town. Then we've also worked together with NGOs with small-scale farmers in KwaZulu-Natal who sell into value chains in and around Pietermaritzburg. And then also thirdly, fresh produce markets in Johannesburg and Pretoria, where shops and street traders buy from, and which are in large part supplied by farmers from other provinces, including small farmers in Limpopo. So we've actually taken those 3 cases, including tracking back those small-scale farmers who've been supplying the Gauteng market, that's Johannesburg and Pretoria, and looking at the outcomes of food system disruption on social reproduction within households. So I want to acknowledge that the input here draws on the collective work of our partners, Masifundisa Development Trust in the Western Cape, University of Pretoria, and the Association for Rural Advancement in KwaZulu-Natal, as well as work by PLUS researchers. So I want to acknowledge the amazing work that's been done. So as context, South Africa had what's called a long and hard lockdown, starting from the end of March last year and varying across different lockdown levels. Immediate outcomes included 3 million people losing their jobs directly due to the lockdown and its effects, including many people in the food system. So initial restrictions were on the informal food trade, like street traders, but these were quickly lifted after an outcry. But there was no kind of return to normality, not least because their reliance on transport hubs and foot traffic for their informal food sales meant that they lost out on markets, regardless of whether or not they had disruptions to their supply. So the overall story, I think, and I'll go through a few themes with some examples, is on the one hand, the privatization of some of the costs of social reproduction, particularly with the closure of schools, homeschooling and childcare, and the shifting of that burden within the home. The closure of school feeding schemes and people needing to take more responsibility for feeding families and providing for health. At the same time that this privatization of the cost of social reproduction was happening, we see the undermining of people's capacity to meet those costs and to reproduce, partly because of declining incomes from production or sales, but also because of rising food prices. And here I think we see a very particularly South African story, which is about even among those who are rural producers, people being reliant overwhelmingly on markets for providing their own food. So a first theme that I want to focus on is about children, school time and mobility. And here, as I say, I think our team has observed that school closures dealt actually quite a devastating impact to women involved in particularly informal work within the food system. As one woman in Limpopo said, it worsened our situation because our kids had to stay at home full time, so the food was not enough. So we see here a transfer of social reproduction costs from the state onto low-income families and primarily onto women. And even after there was civil society litigation to force government to reopen the school feeding program, even while schools were closed, some families got food parcels, but these food parcels once a week were very sparsely delivered. And the nutritional content and quantities involved were a far cry from what children normally would have got at school. One of the issues that many women raised was that whether food parcels from schools, from churches, from the state, from the Solidarity Fund, that actually a lot of the content of food parcels was very nutritionally narrow and also required cooking. And the crackdown on available cooked food was a key issue. In KwaZulu-Natal, we heard that producers were differently affected by school closures. And some women particularly were able to get teenage daughters and other young women and girls to take on substantial social reproductive tasks. In Limpopo, in fact, we found teenage girls complaining that during long periods of being home from school, boys were able to sit at home either and rest or do schoolwork, while teenage girls were having to both farm and clean and support their families. So there was clearly a generational transfer of responsibilities while still being gendered. In Gauteng, what was particularly key with women involved in the informal food sector was the flexibility to be able to take children where they were going. And parents had enormous problems taking their children to places of work, particularly with fears of women taking children to informal trading markets, which, as Akosua has pointed out in the Ghana case, meant that in many cases women opted not to go out because of this impossible choice of leaving children without childcare or taking them to places that seemed to be risky. On the issue of food procurement and preparation and quality and quantity of food, our findings from qualitative in-depth research very much supports the broad picture from national surveys, such as the National Income Dynamics Survey, NIDS, Coronavirus Rapid Mobile Service, known as NIDS CRAM, which is generally, people say, reporting less food, so reduced quantities, but also reduced dietary diversity as people stopped buying expensive proteins, shifted their spending towards hygiene and cleaning products. And also where they were investing more was in supposed superfoods, well, ginger, garlic, lemons, and other things. But I think that we will get a lot more detail as we continue this research, because we are working with groups of people, largely women across the 3 countries, who are keeping food diaries of both what they are producing and selling, but also what they themselves are able to consume in their families. A key issue that emerged in KwaZulu-Natal, which I think has been a blind spot, is the extent to which farm worker families working for small-scale farmers lost their incomes. In the Western Cape, what we see in the fishing communities is a shift from people eating whole fish to eating offcuts. So people rather selling the higher value foods and buying and consuming cheaper foods and stretching them as far as possible. So I think that a key issue here is both the reduction in access to food, lower quality food, and also the picture that was raised in national surveys about adults skipping meals and foregoing food in order to feed children definitely came up, with particularly women involved in what's called shielding children from nutritional shortages by women skipping meals. And this is particularly in a context where most of these people, most people involved in production and sale of food, particularly in the informal sector, are buying most of their food rather than consuming what they produce or what they sell. So I just want to mention, though, that in Limpopo, we saw a slightly different picture from the Western Cape. And this is in much more of an agrarian sector, where there were surpluses as small-scale farmers couldn't get their produce to Johannesburg, to market, and started to sell more into local informal markets. So some people were able to consume some of their produce, some were redirecting their produce into local markets to the extent to which they were producing items for which there is a local market. So here we have an irony that those people who have not commercialized and gone into high value crops for sale elsewhere actually were more resilient in the context of crisis. So I think that a general picture here is of reduction in quality and range. And the third issue I want to raise, which has emerged, and I think differently from the other 2 countries, is a very important story.
Ruth, you have 1 minute, please.
Okay, maybe I can elaborate in question time. A very important story about remittances and migration, given South Africa's history of forced removals, dispossession, and migration. In Johannesburg, we found people who were reporting so-called reverse remittances businesses. So rather than sending money back to families in rural areas, actually people in urban areas who had lost their jobs or lost their incomes in the food system, relying on income, on sharing of incomes, and sometimes also the sending of food from rural areas to the urban. And we found people in Limpopo sending money to Johannesburg, and in KwaZulu-Natal, people sending food to relatives in the city through social networks. And a very significant story, I think, and I would like to discuss further with others, is about young people from cities, in some cases returning to rural areas to live with and be looked after by family members there. Even by February this year, we found young people, educated young people who had years ago migrated to Johannesburg, back in family homes, being looked after, often by older women, because they'd lost their jobs. In some cases, the extra labor and support was welcomed, but there was definitely a strong story from women farmers about having more mouths to feed, and that often it was only when younger women were migrating back to rural areas that they really assisted with labor. So we don't see a strong shift in terms of gendered roles. And a crucial differentiating factor between those small-scale farmers who welcomed returning family members and those who found it an enormous burden was whether or not they brought social grants with them. And I think that more broadly, the social grant story is a key issue in the South African context. And here we are 1 week after the ending of the special COVID social relief of distress grant, which together with the top-ups of social grants has been one of the key ways in which our government has responded to the crisis and supported social reproduction. And I think we must be clear that we're going to see very, very serious outcomes of this loss of crucial support for poor people, whether in the food system or not. So I'm going to leave it there. Thanks.
Thank you. Thank you so much, Ruth. And allow me to thank all our three speakers for those very, very rich reflections. And now we want to open up for discussions, and I hope we have some questions in the chat box so that we can give our panelists a chance to respond to some of these, insightful questions that have been raised by the participants. And in case we don't have questions, then we can do a quick discussion about the similarities and differences among the three case studies that have been presented from South Africa, Tanzania, and Ghana. So let's see if we have any questions. Yes. Allow me to read through this comment and question from Andres. Andres says, all three panelists have given sobering accounts of the gendered impacts of the pandemic on household reproduction. But what do you think are the long-term impacts, and how do women think about the future? So I would allow our panelists to take 1 minute to respond. I think I'll give you, every one of you 1 minute, at least to share your perspectives on this question. What do you think are the long-term impacts, and how do women think about the future? And I would start by Akosua, please, 1 minute.
Thank you. On the part of on the question of what women think, I think that when schools were reopened in January, it gave people a sense of relief because we'd gone for 10 months with the schools closed, the incomes that could be made from selling to schools and so on no longer existed. Children were home. 10 months of that was really exhausting. And once schools reopened, people felt a sense of relief and thought that, okay, we can breathe, things will look better. So that, I guess, is a more medium term. In the long term, I think we have to think about what does the lack of access to credit to be able to restart your business mean for social reproduction. Note that some women have had to eat into their capital. They've had to take on loans to be able to sustain their social reproduction needs. So that has implications for the quality of their productive activities. And that's ongoing. As Ruth pointed out, we have the food diaries. So we are documenting this process of trying to restart businesses and the fits and starts associated with that. I'm hoping that in the long term, the states will consider the infrastructure, because if you give us free water, but we don't actually have access points, you haven't done much for us. And hopefully, what the COVID pandemic has taught us is the importance of setting up our infrastructure right. So that would be my wish for all of this and its importance for us in the long term. Thanks.
Thank you, Akosua. Ruth, what do you have to say about this?
Well, firstly, I think that we're not predicting the future here, but what we are looking at is impacts that are unevenly distributed, and that in some cases are aggravating inequalities. I think that we are not at a stage where we can say what the clear implications are. To the extent to which one can see people who are, and this relates both to your question and also to others, is that it's the flexibility of informality that seems to have enabled some people to weather this better than others. So informality is crucial, this flexibility to shift across livelihood activities and indeed across spaces. So some people went home before the lockdown, others moved after the interprovincial ban on travel was lifted when we entered second phase at level 4. But what's interesting here is how, for instance, in Gauteng, our University of Pretoria team is reporting that quite a few of the people they've been speaking to who remained in the cities, despite not being able to trade, they did so because of the hope that they would be able to, and they needed to be there to restart their informal livelihood, and that the people who went back and also remained in the rural areas were those who had formal jobs. So I think that the informality is crucial, but also the assumption that women can absorb the costs of children being at home, and that women are problematic. So we had a designation of essential services where if you were a producer or trader of food, you were allowed to move around, even during the heaviest restrictions, when we weren't allowed out of our homes, other than for essential shopping. So there was an assumption that women would be home to look after children. And I think that what we need to dig into further through our next phase of research is the extent to which gender roles shifted within the family in this context, in different sectors, and particularly in sectors where women are doing a lot of the farming. And this is very different in our fishing case, where there's a very strong division of labor, with women more involved with processing and more home-based work. So I think that it's hard to say what women think of the future. What is clear is that the very central role of social networks, social solidarity, burial societies was a key thing that kept people going. There was one fascinating story of a burial society where women decided, when the top-up to the child support grant was terminated at the end of October, decided that the burial society would continue to pay out that top-up to their members who didn't have other sources of income. So I think that what this crisis shows is the importance of these forms of resilience, both social and in terms of the flexibility of informal work.
Mm-hmm. Yeah, so thank you, Ruth. Thank you so much. And what we want is to respond to as many questions as possible so that we engage our viewers in order to deepen this dialogue. And so I'll kindly ask to respond briefly so that we take this dialogue further. Louis Fred, what do you think about this question? Briefly, please. Louis Fred?
Okay, yeah, thank you very much. I think it's an interesting question. Sorry for the connectivity. I think it's an interesting and very important question looking long term. But one thing is clear. For example, for Tanzania, where, as I said in the background, that we had no strict and economy-wide lockdowns as in other cases in other countries, but you see how interwoven the economies are and the impacts that that has had into our country. And for sure, looking at the social reproduction, you see how women and the gender roles, how they are burdened. And one thing we could think of is the implication of this long term on the nutrition, for example, of families. And then when it comes to nutrition, you know how important nutrition is, especially for children. And of course, nutrition not only in terms of accessing food, but also in terms of the capacity, as we saw in our interim findings, that women have to balance. And so this affects not only their livelihood activities, but also the quality of care that they give to the family. So I think, as previous speaker said, it's pretty difficult to say and see how long-term this is going to play out. But it should be enough to say that the way it is right now, there is a need for thinking around effective and better social safety nets to at least these marginalized and very vulnerable groups. Thank you very much.
Thank you, Louis Fred. Can we go to the next question now? Andile, can you share with us the next? Yes. So the next question is from Loveness. For all the three cases, how would you describe the groups of people that have been resilient compared to those that have not been, either by their occupation or by their social class, and why? I think this is a very interesting question. Who would like to go first? Yes, Akoso, please.
This is a great question, and I think that it depends on two things. Not so much social class. I mean, the group of people we are looking at are generally in the same class. So I guess it's more a function of differentiation within that largely lower income group. And it depends on how much you've been able to accumulate, no matter how little. So you can draw down on your finances in this situation. But I think a crucial thing that differentiates groups is social support. Is who else can you rely on to help you in these times? And the families that have a wider network are the ones that weathered the storm better. So if you had a grandmother at home, then she would take care of the social reproduction needs in terms of watching the kids. And then you could go off. If you had a daughter, as Ruth has pointed out, then you lay the responsibilities on the daughter because you have to go off to work. So I in our context, I think that the support came from humans who provided the active duty of doing the work, or they shared responsibilities in terms of financial responsibilities as well. We haven't had, we don't have a state that provides us with grants. So in a sense, we are used to figuring it out on our own because the state grants haven't come in much. There is a project called LEAP, Livelihood Empowerment Against Poverty. The amounts are between, I think, $10 and $24 every quarter. Now, that probably takes care of bread, and that's about it. So in terms of relying on that to make ends meet, it's something, I suppose, but not worth much. So I would say those that have been resilient in our context are those with social support in terms of a kin network or a friendship network or community support in that sense. Yeah.
Thank you, Akoso. Maybe Ruth, briefly, before we go to another question, I think Akoso has given a very good perspective on this question. Ruth, do you have to add anything here, please?
I think I partly answered it, but just to say, I think that in our context, there definitely is enormous class differentiation. And some of those who were weathering this among the small-scale farmers better were those who had multiple livelihoods. And of course, here we have families who are relying only on farming, but a lot who have waged employment, including civil servants, teachers, and others. And many of those people who also were farming in villages were able to work from home and actually stopped employing people and used their own and their children's labor. So they were weathering the storm. But yes, I would agree these forms of social solidarity. Also, there was forms of food commons, sharing of food among neighbors, sometimes in more organized ways, sometimes not. The community action networks were a system of solidarity in South Africa to procure and deliver support, mostly food and PPE equipment to low-income communities. But this was an enormous outpouring of social solidarity, but quite short-lived. So I think that it's the multiple livelihoods, it's the social solidarity, and partly it's the sort of dispersal of risk across spaces that enabled some people to withstand this better than others.
Thank you, Ruth. Can we go to another question now? We really wish to have as more questions as possible because this is a very interesting discussion. And the next question comes from Kriak Hakizimana. And the question goes, what is the implication of urban returnees for social reproduction in rural households during this time of the pandemic? And I think this all came from Ruth's presentation from South Africa, but also I saw in the comment, Ghana is also experiencing a similar situation. So Ruth, can you respond in this question, please?
I think the answer for the South African studies, our 3 studies, so based in Johannesburg, Pietermaritzburg, and Cape Town, is that we don't know the impact. Oh, sorry, this is about the urban returnees. Oh, okay. In the cases where we found this, particularly in Limpopo, with people from Johannesburg moving back to Limpopo, you know, as I said, there were mixed responses. Enormous disappointment by parents who'd invested in the education of their children and sent them off to cities to improve their livelihoods, and who in many cases had been remitting money. So in a sense, that was a double whammy for older generation farmers in rural areas, that they were on the one hand losing remittances, and on the other hand, in a sense, their social reproductive burden was expanded by people coming back. Sometimes, in one case, there was a woman whose 5 educated children, plus spouses, plus grandchildren, were all moving back into a village at a time when there were several deaths also in the family. So you can see the sort of explosion of reproductive burden. But I think that it was mixed, and for some people it was a short period. But it was striking for me that nearly a year into lockdown, by the time we were doing 1 round of fieldwork in Limpopo, there were still people who had been there since March last year because they'd lost their jobs and couldn't go back to the city. And this also meant that their remittances that had been used by their parents to invest in their farming, you know, there's a circular pattern of money coming from cities, people investing in farming and sending the produce to Johannesburg. And 2 parts of that were ruptured. The one is the loss of the remittance, and the other is, to the extent to which people were producing, enormous disruptions with getting fresh produce to the market. So I think those are some of the implications.
Thank you. Akoso, very briefly, if you have anything to add, please.
Well, I think in addition to Ruth's point about the burden of social reproduction having increased because there are more bodies to take care of, there was also a way in which those bodies could be turned into the source of creating the social reproduction activities you needed. So on one hand, you have to feed them, but you could then put them to work to take care of the other people in the household. So we found, for example, that daughters who were in tertiary school, who would have been in the city going to school, were now home, and then the mothers could lay the burden on them. Of course, it meant that, as Ruth has pointed out, your ability to get your schooling done and to have rest was diminished. But it was a two-edged sword. On one hand, they were useful to you because you could turn some of them into a source of support for you, but then they were increasing your burden in terms of mouths to feed and so on. So that's what I'll add to that point.
Okay. Yeah, thank you so much. Louis Fred is facing some challenges with his connection, so I think we move on to the next question. Thank you. The next question again comes from Andres. Is there a need and a scope for transnational politics of equitable shares constructed around a demand for social protection and citizens' grants in Sub-Saharan Africa? I think this goes to all the speakers, and I want to start with Ruth. Any views on this?
I'm not sure I fully understand what Andres is referring to, but I think that the discussion around social protection has been enormously shaped in South Africa by the COVID crisis. And the extension for the first time of social protection and social grants to people who are neither children, nor elderly, nor disabled, nor looking after small children. So I think that the end of the social stress grant last week is a substantial rolling back of social protection. I want to say something about citizens' grants, because one of the things that we came across was that in a lot of these forms of support, either from state or even civil society, that the exclusion of migrants was a huge issue, including people who are undocumented migrants or migrants from elsewhere on the continent. So I think that a wider transnational kind of demand around the minimum means of life is now firmly on the table, both within our region but also globally. And in that sense, I think that bringing this debate around social reproduction to the fore and not looking at a food crisis as purely a production crisis, but crisis of social reproduction, and that extends beyond food, and therefore the need for social protection. Yeah, maybe Akoso I can respond more adequately.
No, thank you, Ruth. And I think we have a lot of questions and comments, but also time is really running. And I think Akoso could give her perspective as she's going to do her final takeaways from this work. So I would like now to really welcome our speakers to have just 1 minute to share your final takeaways, insight from this work. And I would like to start with Louis-Fred, because I know your internet is really shaky. So now that you are here, please, your final takeaway. Louis-Fred? Then we can start with Akoso. I think Louis-Fred is really getting challenged with his internet connection. Akoso, please. Then you can start with where Ruth left, and then give us your final remarks.
So actually, I think that will be my final remark, really. The ways in which we would use this period to think about the importance of thinking about social reproduction and production as one and the same system instead of as 2 separate systems, and recognizing that the burden for social reproduction should not fall solely on women. And in that respect, then, a transnational organizing around basic support for families, regardless of your situation, is important. And that these minimums should be minimums that they can actually live on. So it's not just to give them a citizen's grant of a monetary sum, but a sum that can actually ensure that social reproduction needs of a basic family, just the basics. You're not asking that they go to the cinema every week, but that they get their nutritional needs supported, they get basic education. That should be the responsibility of all of us, and not just women in households. Thanks.
Thank you. Thank you so much, Akoso. Louis-Fred, are you in now?
Yes, I mean, sorry again. So I think to what we are learning is that apart from the fact that our responses, country responses, have been different in terms of responding to this pandemic, I think the impacts are real, and of course those at the lower band are much more affected. And I think there is, as one question of also to think around around social having safety nets, at least to shield these vulnerable groups from the effects of the pandemic. Otherwise, I think, as we said, these are preliminary findings, and we're still learning more from the research. I think looking forward, we will uncover much more insights as regards the impacts of this pandemic on not only social reproduction, but the wider African food systems. Thank you very much.
Thank you, Wilfred. Now let's turn to Ruth. Your final remarks, please.
Okay, in addition to the questions around social protection and the need for better systems of social protection as a key demand and entitlement, and indeed the focus of political mobilization, I think that what our work so far is showing very clearly is that the importance of understanding what's happening in urban and rural in conjunction with one another. That we understand migration and the flow of money and people as so interconnected. I think that this defense of the central role of the informal food system is absolutely key. It's where more people are employed, it's where more people get fresh produce. And I think that particularly in a food system such as ours, we should really be concerned if the way in which the COVID regulations were designed and enforced is actually serving to reinforce that divide between a formal corporate sector and an informal sector, and to shift the squeeze of social reproduction onto the private space, onto non-commodified, onto unpaid labor, largely of women. Finally, I think that it's a challenge for ourselves, but perhaps also others, working with social movements or working with communities and doing research, is to look how much there's not just an impact on households, but how much this is spurring on forms of activism, agency, and new kinds of politics, both within the household and in societal levels. I think that hopefully our research in the next phases can contribute in that area.
Thank you so much, Ruth, and all our speakers. And before we close off, allow me to read this one interesting comment from Potia Malobo, who is referring to the Needs Crime survey in 2020, saying that it was scary to see the impact on especially pregnant women and new mothers and their young babies. The worst is that this starts an imprint of malnutrition in child's DNA. A large body of evidence confirms that the effect of maternal malnutrition, of fetal development, and the health of the children in later years. We as Africa need to take drastic action to prioritize the health of mothers and their unborn babies. This is very interesting, and thank you so much, Potia, for bringing this up. So to finish this off, allow me to thank you so much for this interesting discussion, to all our viewers for participating in this discussion. Thank you as well to the whole PLUS team for their organizational support. And if you have any question, any further questions and comments about this webinar series, you can contact PLUS at the address provided in the comments box. I think you have taken note of the addresses. Please also join us again for the PLUS webinars, which take on Thursday lunchtimes, Central African time. And if you would like to share this webinar, it will be available online immediately after we close now. And it will be on YouTube, on the same link, and then it can also be shared through other channels. So thank you again so much for your time. And we understand every now and then when we have such interesting discussions, time is not always enough. But anyway, we were able to get all these insights from this study, and we thank you again, and we look forward to seeing you again in the future webinars. Thank you, goodbye, and stay safe.